Welcome to Weekly with Westbury, our podcast video. Today's topic is where are we at and where are we going in healthcare technology and informatics? I think this statement really rings clear, and I am going to read it so you hear it, you see it, you put it all together. Technology is moving faster than we can keep up with. This has huge impact on high stakes in healthcare. With technological advances, we can save lives more quickly and accurately than ever through early diagnosis, advanced treatments, low-touch monitoring, virtual visits, and enabling autonomous self-care. The rise of health consumerism, digital health, optimizing care along the continuum, and the aim to move care out into the community are the reasons why nurses need to be savvier and more involved with technology and all that impacts its creation, use, and consequences. Obviously, we know that we provide in academia guidance in domains and competencies through the AACN Essentials. However, just to tell you that Domain 8 is really specific to technology and informatics. Also, an undercarriage of that too will be genetics and genomics, because technology-driven decision-making and things like that will be provided through genetics and genomics. So we're going to talk about all of that in this course. We use information and communication technologies constantly as nurses, and this gets bigger and bigger and bigger. And so we're really going to speak a lot of that throughout this course. Many times within your courses, you've heard that nurses need to be at the forefront, right? They need to be sitting at the table for decision makings in healthcare. Technology, communication systems, that is no different. Again, we need the functionality. We need that interoperability. Remember the way that this information of our patients flows from chart to chart, to visits, to states, to every occurrence, that patient is getting optimal care. And it starts with technology and our EHR and all of those others. I want you really thinking about modern technology and how we work through. We really should look at the workflow, right? Because if we don't look at workflow for various of the frontline working disciplines, this is when workarounds are established. And those usually lead to, I'll term it, non-optimal outcomes. So this is just a beginning. You're going to hear about so many more of these emerging technology and trends, and we're going to look into them. You're going to privately look into them. Some of your assignments are around these. Personalized healthcare, that's what genetics and genomics and really pharmacogenetics, medication specific to DNA. And so we're going to look more into that. Telehealth. We'll have an experience within telehealth. We know that since 2019, there have been many changes with that. AI. Lately, it seems like we're hearing the negative sides of AI, but there are so many great sides of AI that we use now that will help us with workload, help us with decision making. Again, supplementing, not replacing our critical thinking establishment. We have a lot of voice technology, predictive analytics. Again, so much of that's really going to predict future outcomes. Yes, could be through DNA, could be by interoperability of the patient's chart and following and knowing some of these things in every occurrence that the patient goes through in healthcare. Mobile device integration, again, we have so much portals on our smartphones for EHR and orders and infusion pumps, at-home monitors, all kinds of different things. With that, and with the, as you can see, wearable technologies, robotics, With that comes some special needs. And what I list at 7 and 8 are some special needs, right? We have a huge need for increased cybersecurity, and we'll talk about that in one of our class sessions and have a lot of kind of background on that. Also, what we find out is that we have an increased access of health information to our populations. However, do we provide the services equally with equity for all of these populations? And I think we can probably answer that question that that's no, right? We can give some of these devices to our patients. We can give them smartphones, we can give them wearables, we can give them monitors. But do they have broadband and internet connection in their homes to allow these items to work? Do we establish their health literacy to find out if they know how to operate these items? So again, there's many things that go along with that. With these changes too, our care continuum is really changing, right? Our healthcare services now, direct to the consumer, is coming to where the consumer is. It's consumer centered. These digital health tools help us provide virtual support. It helps with transportation issues. It helps with our elderly issues of transportation or getting to clinics. So our care continuum is definitely shifting as nurses. Our focus in technology as nurses is, of course, safe and efficient manner of providing optimal care to our patients. And that is pretty universal in all healthcare disciplines. However, we know that there's some barriers in that. We know that sometimes technology takes us away from our patients because we have to document things and do all these kind of different things. Having said that, though, too, as stated before, if we do not have nurses' feedback and hands-on help and assistance in this development, the results will be poor for end user design, right? And the end user design and the workflow affects our patients. So in your lesson this week, you're learning a lot about what is informatics. What are some of our domains and competencies within technology and informatics? This slide shows a little example of some of the things that we can create, what nurses have created, and this list could be endless because there's so many things. We have a huge focus right now on reducing time in the EHR. And you can see to the right some of the value outcomes that some nurses have come up with. To save money, right? Because again, informatics and technology is for optimal outcomes. It's for added security in what we do, meaning by security I mean safety. It will double check some of our motions as well. But it is also to reduce the costs of healthcare, which we know are a huge concern in healthcare in general. I'm going to have you reflect and we will discuss in class, but if you could design or create future technologies or innovations that would change the practice of nursing workflow, streamline processes, and improve patient safety, what would they be? We all have ideas, and there's a budding idea in every single one of us that probably will be something that we invent or bring to our establishments. I discussed burden, and the ANIA, which is the American Nursing Informatics Association, in 2020 defined a burden clause. They also have suggested to many, the Office of National Coordination for Healthcare IT, some of the other accrediting bodies, the Joint Commission, that there is definitely a real need to minimize the burden in EHR. This is the beginning, and many things have come up since then as well. But there's position papers and many accrediting bodies that are involved in the reduction of burden in note or documentation elements. Some organizations already have AI assisted kind of reporting where we can dictate things, and that is actually very helpful, right? It could be very helpful for us. Yes, there's some downfalls that we're going to talk about too, about, translation abilities, accuracy, things like that. But this is all this, we need the documentation, but we need to promote interoperability, that transferring of the information, and we need to reduce the burden of those that are documenting. We won't discuss too much in this class, but there are safer guides for EHR safety, and they are called SAFER, capital SAFER. I've given you the address for that, and I will attach this PowerPoint too to this podcast, but they have come up with some emergency planning guides and guides that are helping with EHR safety, and these are utilized in our accrediting bodies and in our organizations. I like to always say that we see very different ways of documentation, and these can be based on where we work as well, meaning what unit, what microsystem, etc. But here are some basic things of the needs of documentation in nursing. They need to be factual, they need to be accurate, they need to be complete, and they need to be timely. Having said that, you can read through there, but we have to really make sure that we're hitting all of those elements. Approved abbreviations only the facts, objectiveness, not our subjective feelings, right? Measurable things. And we see different standards of this in practice. Having said that, here are some of the most common concerns associated. Missing, inaccurate, or delayed entry of data. I will also add pre-charting. There's a date and a timestamp for everything that we put in. There's a digital footprint, and that digital footprint really needs to be as current and here and now as possible. So there are problems with pre-entry of data as well. Over-reliance on the system. We know that sometimes we rely on the system, we copy and paste, we do all kinds of things that probably are not the right thing to do. We'll talk a lot about clinical decision support, and that's overriding alerts. These alerts are there to help us and supplement our clinical thinking. And of course, we mentioned workarounds. Of huge concern in the EHR is cultural humility, decreasing the bias and prejudice in the EHR. Just to use one of our Epic software that many organizations use, they have developed a SOGI field in the EHR. And that is for sexual orientation, gender identification, gender expression. They add a field of a lived gender and preferred pronouns, preferred language to the EHR. We want to explain and show the transparency of questions that we ask all patients now. Let them know how we use the data or how we're trying to improve care for all. We're trying to eliminate patients from feeling marginalized, stigmatized, and explain when proper name and that is most oftenly termed lived name versus given name. Having said that, we're behind the times, but we're trying to really put these things into the EHR now. For lack of a better word, I'm going to use the term that we're leveling the playing ground, okay? Because there have been a lot of power imbalances in healthcare, right? And with certain populations. I've explained that sort of on this field, but as you can see, this is a part of a chart that says the legal name versus the lived gender, the language preference, the preferred pronouns, and the preferred name. Okay? Explaining things like that, having this in a chart and explaining these things to your patients are very helpful, right? And so again, I always say, what do we think is the downstream impact? Okay, and I've listed that up here for you to sort of look at as I'm talking. And again, you have access to this PowerPoint, to really understand what the impact to the patient is if we don't show cultural humility, and also what is the impact on us as the staff? How do we feel if we are not incorporating this, or our technology doesn't have this already incorporated? How do we feel? Do we feel like our hands are tied a little bit in the cultural humility that we can show? Think about that. Going along with that, this is a little algorithmic display of what happens in the impact of bias in healthcare. And I will just pause for a few seconds for you to be able to see that. Think of your questions, concerns, and what your impact in this discussion is. And lastly, this is a new term, I'm going to say, that is really being brought up in nursing and in healthcare now. And it's technostress. Now, not a new concept, but a newer concept in healthcare, right? And here's the question in the impact of this. It's considered a modern disease of adaptation caused by the inability to cope with new computer technologies in a healthy manner. Again, not a new concept, but a new concept in healthcare. Do we have techno overload? Okay, we work longer and faster at work with our technology. Techno invasion, we're constantly connected. Techno complexity, sometimes is it too complex? Is it not complex enough? We just talked about some of the bias. Do we feel inadequate because it's so complex, right? Techno insecurity, a threat to the job. Are we threatened by not having the ability to cope with technology? And then techno uncertainty, the fast pace of change, which we know is everywhere in healthcare, but technology obviously is moving faster than the speed of light. Many will address this using the VUCA model, and if you've never heard of that, that's listed there for you. But it's a framework that describes and helps leaders address the challenges of a volatile, uncertain, complex, and ambiguous world. And this is sort of listed under this techno stress. With that, I ask you, have you experienced techno stress in your typical work environment? Have you seen this in clinical? Have you been in different aspects of healthcare and you have associated with this? So in other words, I want you to think about that, and we'll be talking more about this in class. Thank you.